So when it has reached the full extent, it is referred to as term. So the baby was noted to be cephalic presentation, meaning the head was held and discussed first. She was lying in a longitudinal line. That means basically the head was facing down, and it was in line with her body. The presenting part was 3 out of 5. Basically, that means that 3 out of 5 parts of the head had come down. The fetal heart rate was 140 beats per minute, and it was normal. There were moderate contractions. So when a mother is in labor, what we call labor, then there will be contractions experienced. So she was experienced. She underwent examination, the private parts. And allow me just to say the vaginal examination was done, and subarachnoid dilatation was 7 centimeters. So the cervix is that part of the uterus. The uterus is where the baby stays, the womb. So it has an opening. It's called the cervix, like a neck. So it was noted to be 7 centimeters because there must be cervical dilatation for the baby to come out. Basically, that means the cervix or that neck and the mouth has to open for the baby to come out. So the cardiovascular system, the pulse, as I noted, was regular, and the capillary filling was less than 3 seconds, which is so that means if I press your fingernail, and it comes back within 3 seconds, that basically means that you are essentially normal. And then the heart sounds were also heard and they are regular. That means the way a heart sound beats is essentially normal, and there are no murmurs. Murmurs are abnormal heart sounds that are felt or experienced when there is a heart condition. So the other condition that was looked at was the respiratory system, and in this system it was noted that the chest was clear. Basically she was breathing well. There were no added sounds. Added sounds basically means somebody has pneumonia, or at times even like a flu, as somebody had mentioned, what would happen is that they added sounds. So the central nervous system, she had a Glasgow scale of 15 out of 15. Basically it means she was fully conscious. Then the other systems were essentially normal. So the diagnosis that was made on the basis of the presentation, the tissue labors, and the examination, it was noted that she was actually in what we call active phase of labor. So basically that means that the labor nervous was in that stage where delivery will be imminent. So as is the practice, the membranes, that means the part that covers the baby. When the baby is in the womb, for protection, she has membranes that cover the baby. So normally they rupture on their own, or at times we usually rupture it, so that then we can explain the baby. So the membranes were ruptured, and it was noted that she had some meconium. Basically, meconium just means that there was some aspect of the fact that the baby was showing some bit of distress, though it is minor because it was grade 1. So it's usually grade 1 up to 3. So labor was monitored according to the national guidelines for quality of obstetrics and perinatal care. So several investigations were actually done, which was actually agreed. So the practice is that even if a mother comes to us and she has had investigations done elsewhere, the practice is actually that we repeat those investigations. And because County 2 has that capacity, that was actually done. So a full blood count, that means the blood levels, the urea and creatinine and the electrolytes. Basically what that means is the way the body excretes wastes through the kidney. Basically all those parameters were normal. Then the other issue that is now noted would also be the cross match, because again that is a practice. When a mother comes to us and we know that she will require further assistance, we normally have to take the blood group so that we are prepared. That is part of the emergency preparedness. Again, these are national and international guidelines that the Nairobi City County is implementing. So the late mother had a review after 3 hours, So it was revealed that she actually had now poor promise of labor because there was no progress in the cervical education. As I mentioned, when a mother is in labor, the cervix has to open at a certain rate. So, and because we have parameters that guide us, if we notice that there is no dilatation or opening of the cervix, and then we also look at the descent, because for the baby to be delivered, the height has to come down. So again, we noted that there was poor descent of the presenting part. So because of that, again, a decision was made for an emergency cesarean delivery. Again, that is according to international standards. And because of this, theatre was alerted. So when you decide to make a diagnosis that this mother cannot deliver normally, you render the fact that this mother cannot deliver to an emergency cesarean section. And category 2 is capable of doing that. So this mother was prepared for theatre, and a theatre team was assembled. It's normally the team. So the theatre team had a surgeon, basically the person to the operation. She had the anesthetist, that is basically the person who would put either the mother to sleep or give medicine such that she cannot feel pain. Then, of course, the nurses that assist in the procedure, kind of the procedure. So, in theatre at that particular time, she was assessed, and what we call spinal anesthesia was administered. So, spinal anesthesia, what that means is that the healthcare workers, the doctors, they will inject at the lower back so that you don't feel pain on the level of the umbilicus going upwards. Again, this is basically standard practice. Nowadays, when we are doing cesarean deliveries, we do not necessarily have to do the general anesthesia. Again, the county has enough personnel who are actually able to administer this spinal anesthesia. So after that was done, the mother was cleaned and draped, and the surgery commenced. So basically, the cleaning and draping is important because that is what prevents any infection that will occur, because you're going to cut somebody open. So the procedure commenced successfully, and a live female infant weighing 4.3 kilograms that was delivered and scored well. So in medical terms, there's something we call an APGAR score. So basically, if the baby cries, you look at the color of the skin and look at if the baby is able to breathe and all that. So she had an APGAR score of 8 in 1 minute, 9 in 5 minutes, and 10 in 10 minutes. Again, these are standard global standards that we implement. So unfortunately, the mother had a cardiac arrest 2 minutes later. So resuscitation was commenced. Again, because healthcare workers are trained on resuscitation, not just of any human being, but maternal resuscitation. So this was commenced, and it was actually successful. So, but it was not that the mother had 40 secretions, which are actually suction. Again, in terms of emergency preparedness, we have suction machines in our theaters for both the baby and the mother. So this was actually done. So when this was noted to have taken place, because again, unfortunately, complications do occur, and when the anesthetist noted this, again, as per standard protocol, she consulted with the county anesthesiologist. So what Nairobi City County has done under the governor's guidance is that for every specialty, with a specialist who has been appointed, so that any person having challenges in the hospital, again, this is whether it's the public or the private, they actually have our numbers and they can call for help. So this is actually what was done. So the county anesthesiologist was consulted and advised on further management. So again, there was a whole team to be able to stabilize the mother, and at this particular point, again in consultation with the county anesthesiologist and the obstetrics team, it was deemed that this is a mother who would require an ICU bed. So, so as all this was taking place before the completion of the surgery, the mother unfortunately had a second cardiac arrest, and resuscitation again was commenced, and it was successful. So the surgery was completed. Again, we had a third cardiac arrest, and at this particular point, let me also mention the fact that this mother was, at this point, she was intubated. Remember, I mentioned that when you're doing the operation, normally what we want to do is to have somebody under spinal anesthesia so that they can actually feel. This is what we normally do. So that we deliver this mother, and then we show the sex of the mother, show the sex of the mother, and all that. That is basically what it is. But because this mother required help, there was an intubation that was done. Intubation basically means that the mother now is actually put to bed and there is a machine that is put inside that will go all the way to the airways, so that then now the oxygen is pumping, and then we assist the mother to breathe. Again, these are resuscitative emergency measures. Again, these are standard interventions that are carried out. So at this particular point, having made that a right decision for further care in terms of ICU care, calls were made to public facilities for ICU, and this includes Mama Lucy Kibaki. Mama Lucy Kibaki is a county referral hospital, and it has ICU. Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital. Unfortunately, at this particular point, the ICU beds they were all full at this point. Then the other bit, at that particular time, unfortunately, because we do a lot of cross-county work under the guidance of the governance in this country, we tried to also reach Kiambu level 5, but unfortunately at that time there was an industrial action. So we again discussed the condition with the relatives of the patient, because what normally happens is that in as much you've taken the consent, the patient has given you permission to take her to theatre. What happens is that if the condition changes, the practice in the county, and again as per national standards, is that you should be able to reach out to the relatives so that then you can appraise them of the situation. And this is what was actually done. So the team worked frantically and were able to get an ICU bed at Kenyatta National Hospital in Othaya, because KNH has an annex in Othaya. But it was felt that Othaya is fairly far, and even the relatives mentioned and they declined that they would not want to take the patient to Othaya. So the reason we were doing all this is because under the Ministry of Health guidance, the emergency services, and like we do also in the county, they are basically free. Nobody can be denied emergency medical care, even as the Constitution stipulates. So the policy is, first of all, look for a public facility, because then it is easy to be able to have care rendered. And again, this is part of the referral mechanism and policy that has been put out by the Ministry of Health under the guidance of the World Health Organization. So in consultation with the family and the relatives, we also asked them if they could get a private ICU facility. And they actually told that they were able to get a private ICU facility. And they got a bed at Abian Hospital in Isili. So they had tried also to get one at Ruai Family Hospital, Coptic Hospital, and Parklands Hospital. So Abian Hospital dispatched the ambulance, which transferred the mother at 10 p.m., accompanied by the county, by the anesthetist and the nurse from the hospital. So when all this was being done, I mentioned that the patient was intubated, was under care. So up to that point, again, because you don't just refer a patient who requires ICU cannot just be referred. It's not like any other patient in an ambulance. So what the team in Kaole 2 did, they accompanied that patient so that then, one, they continue with the any resuscitative measures that will be required, and also to ensure that there is ease of care, there is that transition of care. In as much as they are done a comprehensive referral note, they make sure that they were actually also present, so that then the transfer of the patient will be seamless. So, so that is what transpired through the chair. If I may continue to the second question. And the second question is that whether the medical personnel and management at both Kaole 2, Level 4 Hospital and Abian Hospital adhere to establish emergency protocols, and if there were any instances of negligence or misconduct. So the response is as follows. So the medical personnel and management teams from Kaole 2 Sub-County Hospital in general adhered to establish emergency care protocols as established in the Ministry of Health guidelines and advanced cardiac life support protocol. Again, we mention the fact of the medical personnel and the management of the hospital. And because what the county has established is that any time there is an emergency that requires a patient to be evacuated, like all emergencies, the management of the facility needs to be brought on board. So they had been brought on board all along, and that is why even as the patient was being transferred to Abian, they were well aware. And basically the reason for this is to ensure that, again, all protocols are actually observed. Because when it comes to dealing with human life, you want to have as many people as possible who are qualified. You want to have all the people who can make decisions at any time. They can reach any level of support in the county done. So I would say that the emergency obstetric care procedures, including triage, timely escalation, and appropriate referral pathways were followed. So basically what we mean by triage is this. So this is a patient who walks to a facility, and you look at her and you think she can deliver normally, referring to my earlier description. Because there are patients who can come to you and you decide, no, this patient goes straight to theater. There are patients who don't even stay in the ward. They go straight to theater. Again and again, we're able to do that. That happens all the time. And the governor did mention that Pumwani Maternity Hospital, the largest hospital in East Africa, experiences this all the time. We get patients from all over the place, and you make a decision. You have to have a very good triage mechanism so that you can make that quick decision. Is this a mother who can deliver normally? Is this a mother who requires an emergency cesarean delivery, or is this a mother who requires ICU care straight away? So that is what was done. With regard to escalation, I did point out that at that particular time, there were qualified health personnel, and these are people who are ratified by the Kenya Medical Dentists and Practitioners Council, the Nursing Council of Kenya, the Clinical Council again of Kenya. So with regard to that timely escalation, because for you to do an escalation, you have to ensure that all the appropriate specialists are on board and they are fully qualified. So again, that decision was made. The decision to say this is a patient who requires monitoring of labor up to a certain extent. I think the decision to say, at this far we have come, this is a patient who now requires to have an emergency cesarean delivery. And then after that, to say that now that there is a complication, the most important thing to do first of all is to do that resuscitation. Then after that, you want to do the escalation. So that escalation means you're calling more people and you are reaching to higher levels of care and management. And again, appropriate referral pathways. I did mention that Mama Lucy they looked for ICU in Mama Lucy. Kaole 2 and Mama Lucy are fairly close. So that is why the first point of call is actually Mama Lucy ICU. If not that, then Kenyatta and the others. So again, this was done according to appropriate referral pathways. And I did mention that when the place for ICU was actually found, they send an ambulance, and again, that is important. They have to send an ambulance that can actually carry this patient. So again, that is within the established protocols of the referral mechanism that has been established by the Ministry of Health that the county implements. So all this was actually followed, and of course the fact that this mother was actually accompanied by the healthcare workers, not just any healthcare workers, but the healthcare workers who actually seeing that patient. Again, that is quite important. So while receiving care at the hospital, I would say that the patient unfortunately experienced a cardiac arrest shortly after delivery. And again, I mentioned that the resuscitation was done according to advanced cardiac life support and advanced life support in obstetrics guidelines. And the reason we say this is because the Kenya Medical Dentists and Practitioners Council and the Nursing Council, they only give licenses to staff who actually, one, who are qualified, and then number two, they attend a continuous medical education. That means they're able to do resuscitation.
Through the chair.
Yes.
Senator Wakoli. I think good has taken us through the scenario as it were, from reporting to the explanation. He was taking us through on the laid down protocols as ought to be. So I tend to believe that the second question on whether the
Senator Wakoli, and in fact, let me give Kailas Daktari. I think that all portions we have enough to where you have a Bian hospital, so that we're able to wind. Remember, we have members here have a number of questions they would like to ask. And we have a couple of statements, otherwise we shall stay here all the way to 3 p.m.
Yes, as guided chair, let me just move to Abian, but also just mention that one of the questions that is separate from what I've actually described, and which is quite important, even as the governor has alluded. He said, the question is that whether sanitary conditions and standard of care was meted out for this patient. This was actually what was done. Let me not go into the details because I've already alluded to that. So specifically, with regard to Abian Hospital, so Abian Hospital is a private facility, as I've mentioned. It's located in Nairobi City County. And we just want to say here that its adherence to establish emergency protocols and other aspects of care can only be answered by the facility. This is a private facility.
Thank you very much.
Yes.
Even before you leave there, Pana Daktari, who is responsible for quality assurance in the facilities in Nairobi County, whether private or public? Does your team, is there a team that does inspection? So before you tell us it is private, just know that you have also some responsibility. But I have questions around that. Let me allow members to ask clarifications on some of the issues that they have raised. And we shall start with one of the statement, Senator Veronica Maina.
Doctor, thank you for the detailed answer you have given, response you've given to the statement. It was a very sad incident to have Rose Wangari Maina, a 23-year-old woman who's from Kangema but living in Nairobi, die while giving birth in this day and time and in this age of high technology, better health services across the whole world. And being in the capital, she should have stood the best chance and opportunity to survive through childbirth. Childbirth should never be a cause for death for any woman, least of all a 23-year-old who is an energetic mother and able to deliver a child and had delivered one child before. I have a few questions just related to the response you gave. Who gave you the detail that Rose Wangari Maina was 150?
Senator Veronica. Now, Daktari, take note of the questions because she's going to answer to us all our questions. Then you will give responses one by one.
Where did you get the data that Rose Wangari Maina was 150 kgs when she came to the hospital, the Kayole 1 Health Center, the Kayole 2 Sub-County Hospital? Who gave you the detail that she was 150 kg, while in actual fact, she was 90 kgs? That's one. Number two, she was taken to theater at 4 p.m., but after delivery and after complications arose, you were looking for an ICU bed, and you were not able to trace an ICU bed in your referral hospital. How many ICU beds do you have at Mama Lucy? Are they 5? Are they 10? How many beds do you have? And because I can see there were other mothers who lost their lives in Nairobi, has any efforts been made by the county to expand the capacity of the ICU beds so that mothers can have safe delivery and safe motherhood? How long did it take you to search for that ICU bed, and who had recommended for an ICU bed in Udhaya Hospital? How did you hope to move Rose from Nairobi, cruise through Murang'a County, cruise through Kiambu County, go to Nyeri County, and locate her a bed so many hours away from Nairobi? Would she have stood even a chance if your advice was followed, the advice of your doctors was followed, to give her a bed in Udhaya? Is there a possibility, because of the errors and the negligence that Rose experienced, it exposed her to the risk of fatality, and she suffered fatally out of the whole experience of delivery, that if Rose had been given proper care, the closest you have come to admitting that there was a delay in her CS operation is when you indicated in your response that because there was another patient in theater, you could not immediately move Rose to have the CS in a timely fashion. That's the closest you have come to admitting that there was a gap in the kind of care that was being administered, that it was not administered in a timely fashion so as to save her life. But you don't seem to admit that the fact that you were searching for a bed around Nairobi and couldn't get it, your doctors even had the guts to recommend an ICU bed in Udhaya. How negligent was that?
Thank you very much, Senator Veronica Maina. Maybe now I allowed Senator Veronica Maina to ask at least all the questions she had because it's on her statement. I want to ask for your indulgence, colleagues, that if everyone can ask a maximum of 2 questions so that we can dispense with we can get the responses. Senator Sifuna.
Yeah, 2 questions. Daktari, in your response, there is an explanation that the patient suffered 3 cardiac arrests in sequence. There is no mention or explanation as to the causes of those 3 events. And secondly, Honorable Chair, you can see that the crux of the matter, and something that I think this committee should focus on, is that response at page 3 saying that all the ICU beds at Mama Lucy and Kenyatta National Hospital and Kenyatta University Teaching and Referral Hospital were full. That is where the problem is, and that is where our focus should be. Governor, there was a development that was going on there for 120 bed capacity maternity building at Mama Lucy. Kindly address yourself to that. And the one that the neonatal ICU that had been started by the NMS that had stalled, just address us to the current situation of those 2 projects. And then I think, Chair, we should be able to get some light at the end of the tunnel. Thank you.
Senator Onyonka.
Thank you, Chair. Daktari, I forget your name. What did you say your name was?
I'm Dr. Gideon Mutua.
Dr. Mutua, thank you. In most probably 1 sentence or 2 sentences, in clarity and in order for Kenyans to really understand what the issue that we are discussing today is, what actually killed this lady, according to you? because you've really given the story and you left what is critical. She died. So can you please tell me, did she die because of a bleeding, because she was not, her case wasn't handled professionally? Did she die because, I just want you to tell me, as a doctor, what actually made this lady pass on?
Thank you very much, Senator. Senator Tabita.
Thank you, Chair. Actually, I'm just coming from where Senator Onyonka has left it. And keenly, after listening to your submissions, you've presented a scenario of the general examination of this particular patient. What caught my attention was that the chest was clear. No, everything was clear in general. So what actually caused this cardiac arrest? That's where my concern is. From where Senator Veronica also mentioned in terms of the theater was in use, why could you not make a management decision then to move her to the nearest hospital for theater? If the theater was in use, why did you still keep on holding her until the theater was free for use? Because, Chair, from what we are observing, it's like the management was just reluctant. I perused the last page and you said in your response in terms of the policies when the senator asked, and you says the county cannot give any policies. When she asked the way forward, how do you manage all these problems? And you say the county has no response. That leaves a lot.
Point of order, that's not what the answer says. The question was which policy measures are being undertaken by the ministry.
You know, you have been in this house and you can only speak through the chair, so you cannot just switch your microphone.
Chair, kindly permit us to...
Yes, I have no problem in permitting, but I'm only saying it must come through the chair.
Yeah, you know, I've not been in the house for a while.
So, Chair, through you...
Let Senator David just finish. I'll allow you, Governor.
Chair, through you, the response at the bottom says the county government cannot answer on the current status of policy measures and interventions to reduce maternal mortality during and after childbirth to ensure that childbearing is safe, dignified, and not a cause of... This question, when the senator asked as far as the county is concerned, and we believe, and I'm happy to see experts from the county, the doctor, the CEC, and so we are optimistic that they can at least be able to give at least guidelines as far as at the county level is just concerned, because health is devolved and these hospitals are at the county level. Thank you, Chair.
Thank you very much. I think, Governor, you don't need to respond on that matter. I will just give guideline. You know, Dr. The fact that the question was saying policy measures, interventions currently being undertaken by Minister of Health to reduce maternal health care, at least the bare minimum you should have done is to tell us what you are doing as Nairobi County Department of Health. Your governor just said in Pumwani there has been a reduction of mortality rate. We would like to know what is that you have done to reduce. So next time.
With your permission, Chair.
Yes,
the county cannot speak the way they are speaking, because even if there is a national government policy, they would be aware of it. At least say that we are following the policy guidelines put by the Ministry of Health. These are the ones. You're not responding on behalf of the ministry, but you're saying you are aware. This, yes, this is the general policy that has been set for us to be able to address the question of maternal health care. It's not as if you don't know. You know. You are aware.
Thank you very much, Governor. I think because we have so many questions, we shall allow them to respond. But so that
you said you'll give me a...
Yes, I'll give you. So that as you respond, I want your team to also take the following questions. Overall, in Nairobi County, how many ICU beds do you have as a county? That is one. And then number two, did the officers who are transferring the patient to Abian sign the transfer forms protocol? The requirement for transfer of patient is that the physician at the hospital in Kayole 2 should first have spoken to the physician in Abian. Did that happen? So that the readiness of receiving that patient would have been established. And then What is the level of Abian Hospital? Governor, you can take, then we can get the responses.
Thank you, Chair.
Chair, I have one more question.
Oh, sorry. Senator Bita, you can go on record and ask your question.
Thank you, Chair. My name is Senator Hamida Kibwana, member of this committee. I was just wondering, Daktari, due to the weight of this person, is it 150 kgs? So, yeah, I was wondering, maybe is it because of the weight? Then, of course, maybe there was an overdose of the anesthesia. But then, did she suffer cardiac arrest while she was?
She was not 150 kgs. She was slightly bigger than this lady sitting here.
Senator Veronica,
Don't say 150.
you know you cannot estimate weight by seeing with your eyes. Please.
Wait, your pregnancy.
Don't worry.
Through
the chair. You cannot allow that unless you provide evidence that the mother was actually 90 kilos, which we shall allow you because you are the one of the statement.
Can I finish the
Allow Senator Tabita to finish her question.
Maybe, that's what I'm saying, maybe due to the anesthesia overdose, then maybe she could have, suffered a cardiac arrest. I'm just wondering, just a question to the doctor.
Thank you very much. Governor.
Thank you very much, Chair. Chair, we're very keen to answer questions as asked. But we will not split hairs. We can give you an additional response on the current measures that the ministry is undertaking. But also better than that, we'll tell you what we are doing as the county government of Nairobi. Chair, the reduction of mortality, which was very high, I'm sure you remember, even when you were governor, the number of issues on Pumwani, on Mama Lucy, etc., that would come up every week were very high. Chair, we changed first the governance structure of our hospitals to make sure that each hospital is led by a CEO at the level 5, not a medical superintendent. A medical superintendent is good, but their training is on offering medical services. The introduction of CEOs, and you can be a doctor and be a CEO, but you must have additional training on hospital management, on supply chain management, on dealing with human resource for health, on dealing with commodities, and and facilities, how the place is it receptive, what is the best layout. There are many things if you look at hospital management science. And that has given us great success in our hospitals. The first thing I did, I can remove this because I'm not reading. Actually, it was the 20th day after being sworn in, also set up as a health reforms task force that was led by Dr. Olive Mugenda and several professionals of note in HR, Dr. Komunto, in the private sector, Anastasia Nyalita, who is now a CEC, but she was a CEO of private facilities. So there was the owner of St. Mary's, Dr. Frida, to actually come and critically look at the state of health in the city and the facilities and what needs to be done. The implementation of that is what has given us great results. While we regret the death of Wangari, which is regrettable, it is a huge, there's been a big, the numbers used to be very bad. And Chair, one of the things it said that actually embarrassed me, because I was the senator previously, Nairobi County had 0 ICU, 0, before I got into office. There was no ICU facility in Nairobi County, owned by the county government. The only facility of ICU in Nairobi was owned by Kenyatta National Hospital, which is a referral. That is the only public ICU that was in Nairobi County. Chair, in the last 3 years, we have developed, if I count the number of ICU beds that we have, Mama Lucy Kibaki Hospital are 18 beds. Yeah. From there being no ICU, 4 of the main ICU, PICU, which is pediatric, 6, neonatal, 8, from 0. Mama Margaret Uhuru Hospital now has 10 ICU beds. So that is 28. Mbagathi now has 8. That is 8 plus 28. NICU that are 4, neonatal. And by the that NICU has really saved lives because it's where preterm babies born before, the babies that are born before their time. Yeah? And it's the best place I go to because I was also severely preterm. You know, so I go there and I encourage the mothers and I do the kangaroo, which now fathers are doing kangaroo, you know, sitting with the children, and that's from Kibra. Neonatal HDU is 4. Ongoing, right now, we're at 90% to increase another 10 ICU in Mutwini. It's 90% complete. Actually, interestingly, I posted that today. 90% complete. And we are now moved to operationalizing. Now the ones which we've completed but are not operational. So those are the numbers that we have. It's an improvement. In 60 years of Nairobi, there was 0. In 3 years, we are at more than 30 ICU beds. But how many are enough for 7 million people? We definitely need, there's a gap. There's a definite infrastructure gap when it comes to healthcare in the city that talks about resourcing. We have 7 million Nairobians during the day and 5.5 at night. So even as we do these incremental increases, there is still a huge gap that we need to look at. And that is why, even if you look at the national government stance, while supporting public facilities, also private facilities are seen as part of health infrastructure for this country. It is true that quality control is done jointly by both the national government and the county government. We have a team of quality assurance, and that work is done between ourselves and the Kenya Medical Practitioners and Dentist Council. So we have a role. In as much as health policy in 4th schedule is set by the national government, the county also, because health is the biggest devolved function. It has our biggest staff component in Nairobi, whether it is the doctors, nurses, clinical officers, dentists, etc. And if we had time to go into the details, we'd show you the improvements there. Now, you know, Nairobi, we had no dentists. Now we have more than 50 that we hired every sub-county. Dental services were seen as a luxury. Today, every sub-county, there are dentists and there are dental chairs, you know, that are available. So if we had time, I don't want to go outside this statement, we'll be able to respond to that. Chair, on the other questions.
Before you leave that, Governor, so that you can finalize with a question by Senator Sifuna.
Yes.
I think I had 2 questions on complete. What was that?
Yes, there's a specific project
that
is mentioned.
Maybe you can finalize on that one because it looks like it's along what you are speaking about.
So at, and I'll ask the facilities to also prepare to give more details. There was one building, 120, that had stalled. It was part of what was being innovated. It took long. It is now with us. We made first payment of 50 million shillings. The contractor came over there.
We shall take a walk there.
Oh, very welcome.
You are a facility person to respond.
But for now, there's a by-election. Maybe you...
These are politicians.
Can we hear about, we might even enhance the by-election?
The county, we should have the contract.
My friend, just stop there. We have about 10 departments to run. Then what is this gentleman doing in that place? We expect him to give us more accurate information. You are supposed to be having a general view. If you are going to have details explaining the context and he doesn't have, then we have a problem.
In fact, Chair.
So before you respond, this gentleman must give us a, my friend, can you give us a proper answer? What is the exact position?
The seat you help maybe. Take him the seat.
Thank you, Chair. The contract for Mama Lucy Kibaki Hospital, the facility that is stalled, was innovated from the national government to the county government of Nairobi. And as mentioned by the governor, the initial 50 million that was paid was for works that had already been done during NMS. And then there is a pending certificate that needed to be paid, which is why the contractor is not on site. So that is what I'm saying. We already have a budget in this current financial year to pay the contractor so that he can be able to complete the project. Thank
now hold it there. At what stage are we in this financial year? Isn't quarter 1 over? Yes. Was that money in the budget in quarter 1? And why was it not paid in quarter 1?
Secondly, Chair, you are saying you're going to re-advertise the project, because the indication from the governor was that there's already a contractor on site and he knows the name of the contractor.
Chair, let me help the officer because I'm not who signed the response.
Okay, but
And I have the full responsibility.
and just take it. You know, these are the things we said. We are not going to allow people who will be coming to this committee to give us shoddy answers, and then the governor is giving us, because I can tell. I can see he's already trying to whisper to CC. That means the answer is not accurate. So anyway, just give us your perspective, but we shall make a determination on that matter.
Chair, the officer is not wrong. The 50 we paid while the contract was still at NMS. That's why we sought exemption, yeah? So the contractor can keep going. Due to the delay of the novation, and that was from the national side, the contract expired. Same person to complete the work. That is what he's trying to explain. We've had challenges with EGP as counties. I think that is national. Everyone knows that there's been that challenge. We've sought exemptions to actually, on the health sector and the environment sector, to actually use the IFMIS, where as the case might be, because those are critical things. You can't wait for EGP to work for you to procure medicine, in your hospitals, etc. Those exemptions have been issued. So by June, we should have completed that project. That one.
Just to talk about the weight. As
Senator,
much as
I know the that are good. If you look at what he was reading, some of them we don't even know how to pronounce because of the. Thank you, Chair. We don't even know how to pronounce because of the. Thank you, Chair.
That from weights and measures. That from weights and measures.
Yes, we do. We have a maintenance plan.
That's all. Once you have answered.
30 minutes. Our referral mechanism is able to ensure that we have an ambulance in place with even 30 minutes, whether it's a public or a private facility, as long as it is a mother or a baby, and that is free of charge. So that is able to evacuate patients, whether a patient is in the hospital or a patient is actually at home. So that is the timelines that we have right now. So the other question is about the patient being referred to Othaya, Kenyatta National Hospital, Othaya. So the procedure is that you look for ICU beds in all the places that you can get. Then having done that, you have a triage to know which is the nearest ICU place. And that is where we start. And that is why towards the end, there was the aspect of Othaya ICU. And the decision making for a patient and the relatives is done by the healthcare worker giving the relative information, contextualized information. So we tell them where Othaya ICU would be, and then we tell them these are the options we have. We have looked at any other place, and this is the farthest public facility that we could get is Othaya. Hence, the nearest public facility would have been Mama Lucy Hospital or KNH. But the farthest that you are able to get at that point, having exhausted all the layers according to referral guidelines, is...
Could you kindly allow me to assist Bull? Public facility by radius from Kayole that was available at that point is the Mama Lucy, the Kenyatta annex that is talking about, just to clarify. Second clarification, the wait in time, our standard is 8 minutes, not 30, for an ambulance and for a fire engine. That is the standard waiting time, not 30. That is the policy. I've confirmed from the CC as well.
Through the chair.
Senator Veronica?
Yes. I'm very concerned because what the doctor is now doing, he's giving us the hypothetical, delayed procedure. The question before the House or before the committee is about rules. A response on how long it took for them to get that ICU bed. Because a specific case, a specific
Yes,
statement.
I think that's the question.
He's giving
Actually,
generalized ideas on procedures
tell
which
us
never
so
worked
that,
that day.
so that Senator Veronica's question can be answered. Dr.
Sure.
Would like to know how long did it take from the time a decision was made that the patient should be referred to an ICU facility? From the time the decision was made to the time the patient arrived, how long did it take? Senator Tabitha?
Senator Veronica, I would request you, as we are being given your answers, if you could just start on what caused the cardiac arrest, and then he continues responding so that we can synchronize with the answers that the doctor is giving, because I'm just 100% curious on what caused that cardiac, and then we drop like that. Through you, Chair.
Doctor?
Oh, thank you very much. So the cause of death for Rose, at that time we were not able to ascertain the cause of death. The cardiac arrest is a general term that we'd use when there's a problem with the cardiac circulation. At that time, it is difficult to actually get to understand what is the actual cause of death for this patient. Because after that, resuscitation was done and the patient was taken to Abian Hospital. So the actual cause of death, or what was happening at that particular time, could not actually be ascertained at that particular point.
Just a minute, Dr. You know you were given an invitation as a county to appear before this committee, and the questions were well spelled. You know, when a patient dies, the last summary there gives the details. It didn't bother you to find out, now that we are appearing before this committee, to have all those details of that patient, or what transpired. Remember, if you read the protocols for referral, it says the physician of the referring facility must, the ownership of that patient is at the hands of the referring physician until they hand over. And they have a responsibility to constantly keep in touch so that by the time that patient is discharged, the records in your place and in the other place, there's a closure. Did that happen? Did you check, now that you are coming here, did you check to find out what caused the death finally? If you didn't, just say no, we make progress.
No.
Proceed to the next question.
So, thank you. Maybe through Chair, as I proceed to the next question, what I also wanted to clarify is that for all patients who die, the Ministry of Health guidelines that we implement through the governor is that a postmortem must be carried out.
Dr. Let us not go there. Right. We have said make progress. The question that you need to answer for Veronica first so that we can make progress is, from the time a decision, and I can see there are two names, I said three, who are handling. Dr. Jen Kemunto, is she with us? She's not here.
No.
Marianne Musyoka?
No.
Dixon Mutua? Doctor, did you talk to them before you prepared this report for governor's signature?
Yes, Chair.
Okay, now answer this question. We don't want to go around. How long did it take from the time the management made the decision that this patient needs to be referred up to the time the actual referral happened? How long did it take? That was the question Senator asked. Thank you, Chair.
So it took 4 hours before eventually the patient went to Abian Hospital.
Thank you very much. Now let's go to the next question.
So the next question was about the cause of death. I think that has been, we have answered about that. Again, this was also the question that was asked by Senator Onyonka. I think we have answered that. Let me come to the question asked by Senator Tabitha. And the question was, at that particular time, when the patient was deemed to have required a cesarean delivery, what was happening in theater, and why was the patient not taken to another facility?
Constituencies, on 16th of December 2024, this question originated from those conversations we were having with them. As you can see, the question was brought before the Senate on the 13th of January 2025. This was out of the conversations we had with the CHPs themselves. Now, the question is not talking about masks. These people, you know the environment in which they operate in, including the informal settlements, and when it's raining, Governor, the way that it is raining right now, they are saying there are necessary tools for them to be able to do the job. Gumboots, raincoats, and gloves. So when they say we need these things to do our job, that question cannot be wrong.
Chair.
Yes, Governor.
With your permission. The reason why I said it is wrong is because, and there's a standard of what is in the kit that is set nationally. This is additional. So it's the right question. Why don't they have now gloves, raincoats, gumboots, and masks? They are given case by case, depending on what they are sent. It is not given to all of them, because you see, they cover 782 households. That's why there are 700 and how many households? 782,000 households. That's why there are 7820. And not all of those areas throughout the year would require gumboots and gloves. Beyond the standard kit, because remember, there's what the national government is doing in the county. All counties are matching 2525. But Nairobi, we increased it. We're doing more. We're doing 35. Where there is need for additional, Chair, and the director will give more details, we actually provide, but it's not a standard provision for all of them at the same time. Maybe you can clarify. I hope I'm not wrong on that. That's from what I know, but just clarify.
Governor, you're exactly correct. We, in the case of the coordinator has asked about the gumboots and raincoats, we did a procurement in November 2020. We were able to supply 1,200 of them with these commodities in response to the cholera epidemic, which we were able to control as Nairobi County. That was running then. We are able to give commodities, and particularly those around WASH, and these are commodities around the WASH response, to the CHPs whenever we have any outbreaks, and we do this with support from the county government budget as well as development partners. When it comes to the CHP kits, we receive this from the national government. We have accounted for that, and we have a distribution list of how these kits went to the CHPs.
Thank you very much.
And so,
let me help you so that in future you frame your answers correctly. You know, we are not asking for very complicated answers in the Senate. Why don't you just come to the Senate and say, you have asked about this, give us details and say, we have supplied 1,200 CHPs on this particular area, in this particular period, with the following commodities. Okay? There is no competition here. This is just feedback from the CHPs who are saying, we want to work for Nairobi County better. Some of these places are not accessible, we need gumboots. This, you know, just direct answers. You know, if you say under WASH program is a complete another different program. We cannot wait until there's an outbreak of cholera for us to supply them with gumboots. It's raining every day in Nairobi, you know. So what we are saying, I've had your answer, but please, you know, I can tell you, Governor, you know the problem with some of the answers we are given, and sometimes we sign them off, it starts with perception. You know, these questions are being asked because I'm being fought, you know, those things. Please, Daktari, you have good answers, but you see, you have not collected your data well. Just provide data and evidence. It solves our work. In short, go and look at your budget, go and look at your procurements. You know you are Nairobi very well. We know the season we are in the country, where they need to be facilitated with gumboot, facilitate, and we agree with you, not all places require those commodities, so give those who deserve, so they can give you a better service. Can you go to question number 2?
Chair, just before you go to question number 2, you know, there is an attitude from the Nairobi County government that they can be clever with words, and they think we will not know what they are saying. Because what she is saying is they went out to buy gumboots after or during a cholera outbreak. You have a full complement of 7,400 CHPs, Governor. 7,400. You know their job description. You have sent them out into the estates to do this work. There are certain basic things that from the beginning you would think that they would require. That's the whole point. If even for you during the campaigns when you sit with these CHPs, the question of gumboots has always been there. From 2017 to 2022, you talk to the same people that I talk to. So the expectation is, if you can tell us of the 7,400, 4,000 don't need them because they work in, I don't know which area of this is Nairobi that you think that they will not need gumboots, because when Nairobi floods, it's all over the place.
Oh, they're not on the...
That's what I'm saying. So you will tell us of the 7,400, we have provided 4,000 gumboots for the people who work in these specific areas because of the sort of hygiene issues that are there. If somebody asks for a raincoat, Governor, which ones will you give raincoats, and which ones do you think, even if they are rained on, it's okay?
Chair, it's such a simple issue. We shouldn't split hairs.
No, it's not a simple issue. The reason why we are splitting issues is because you've decided to split issues. The response that is coming from her, she decided to tell us that they bought 1,700. She needs to tell us for whom, as the chair has framed. So can we have a conversation? Are these things that the county government thinks are necessary for these CHPs to be able to do their job? And if they are, then we say only 3,000 of them need it. These ones don't need it. And if you can be able to give us that breakdown of what has been done. So unless there is another cholera outbreak, can the remaining 6,000 or so...
I think you have made your point, Senator Sifuna.
Gumboots.
Let me just allow some small clarification, then we go to the question number 2.
Chair, we'll give all of them.
That's enough.
If there's someone who has actually, in your answered, the issue of even giving CHPs in Kenya a stipend was brought by me in this house. I believe in the work of CHPs, and we were the first county to give them a stipend, and our stipend is the highest.
Now you have
so if something can give them, just allow me to answer. If something can make them work better, I'll be the first person to do it. We shall provide additional. What we said was the essential, the basic essential that's a national standard has been provided. We shall do more. I think it's a fair case. You know, we shall do it.
Very good. Now let's go to question number 2.
Number 2 was the measures being taken to address technological support gap. Chair, long and short of this is that we have 7820 CHPs. The provision by, these devices are being provided from the national support. They provided for fewer than they are. So there's been a push as COG because it's throughout the counties, it's not just in Nairobi, because you want standardized equipment. And so that procurement is being done at the national level. I think the support from one of the organizations, is it CIF or who is it? One of the...
Yes, it's CIF, yes.
Child Investment Foundation Fund are the ones that procured that for the national government. So they will bridge that gap for all CHPs across the country, including Nairobi. The next question.
So maybe, Governor.
Yeah.
So how many were provided for Nairobi?
7,000.
Because then it makes it possible for us to make a... This is their work.
So 7,502 were provided with that, with the devices. The gap, therefore, is the difference with 7820. That's the difference that we... So it's been tabulated for each county, how many need to be done. We will be very happy if the Senate can assist, and we can provide the list from COG for all the counties, because it's also not neat and clean and fair for them. You're working, one CHP has this device, another one doesn't have the device. Remember, the national government was working over 100,000 CHPs. There are more than 100,000 CHPs in Kenya. So that is why the gap is there.
Yeah, Chair, the question also covers the qualitative aspect of the devices themselves that have been provided. The conversations with the CHPs that it is old technology. Most of the time it's unreliable, it's failing. So maybe you can address that as well in terms of the quality of the technology itself to be able to do actual online reporting. Because when we were with them, the demonstrations there, those phones hang 90% of the time, Governor. And it makes their work very, very difficult. So maybe you can address that as well. Instead of buying the machine for chapatis, maybe we should buy iPhones for the CHPs.
Senator Sifuna, you are out of order.
Sorry, I didn't hear
That is a completely different program that doesn't even fall within the mandate of this committee.
What it is?
If he has anything to ask about school feeding, he should go to the Committee of Education.
No, it just shows that it is lunchtime. Something, anyway. Chair, this ICHIS program is national. They're the ones providing the software, the devices, some say even the bundles. And Chair, we have been insisting as COG and as counties, just leave that entire thing to counties to do. Because we can provide software, we can then look at the quality of it should be left to us. I'm glad I've seen what you passed recently, that you've put the entire now stipend from the national government as a conditional grant to come to the counties. Because even to the next question, there's no delay of stipends from the county government. We never delay, not even once. There's no month that they have not been paid. But the national component sometimes can take 2-3 months, and then it comes in lump sum. But the county one has never gone beyond a month. Sometimes it might be late in the month. Because I said it very clearly that no CHP, or rather that I, as a governor, will not be paid before CHP as a stipend. We're on the same payroll. So I am paid on the same day, the CECs, the directors, and the CHPs. We're all paid on one payroll on the same exact day. So, again, it's something the committee can take up.
But I think that is okay. Now that we are put as conditional grant, it will all come. So payment.
But see, that's just the money. Now the software, the management, the scoring,
what you need to do now so that we can help you. I think now ask your chair of health at COG to give us a report.
Oh, good.
So that we are now able to follow up. In fact, 2 things, so that we are able to help address that issue of CHP. Let us get the data on the number of CHP without the kits, so that we can follow up with the ministry to exactly provide. Then 2, the challenges they're having in terms of technology and so forth, so that we can follow with them up to upgrade. And your proposal as a COG in terms of it being left to you, so that we can still pursue the same trend of making that provision of resource a conditional grant, so that it can now be managed from counties. That's why there is need for collaboration between COG and us. But your chair hardly comes to any meeting called by the Senate, so you have to get perspective. Senator Sifuna, so that we make progress.
Governor, there is a question that I was asked to specifically put to you by those CHPs. They understand that the component that delays is from the national government component, right? And county governments, I think including yours, whenever the disbursement of equitable share delays, you have found ways to make sure that you pay your people. That's a fact. Why are they not included in the similar program so that you are able to pay them the full one, covering even the bit by the national government, and then when the money comes, you're able to deal the same way you deal with salaries when there is exchequer delays?
We can look at it for the government component when it delays. The only issue that I foresee we would have is COB approving that difference, but it's not a big amount. It's something we can explore, definitely. Yeah, so that we can cover for national when the money comes. But now that it's a conditional grant, again, the exchequer delays really hold counties back, But the covering for the national government 2.5, if COB allows, we can be doing it. And then when the money comes, we now take it back to our CRF for other purposes. That's a very good idea.
That now you can explore that. Now the last question there.
These are things that we should even just be discussing, because these are such a good idea.
Don't make me make some comments.
This is why we want you to be coming
to the struggled to avoid
more often.
Sifuna has just said it, so let's make progress.
It's a good idea.
The last question.
Chair,
Senator Sifuna.
These conversations cannot happen anywhere else, Governor. This is why we insist that you come here.
It's good.
We exchange ideas.
Thank you.
Chair, I wanted to say the same thing. I think Governor, being Senator Emeritus, I told him the other time he needs to use us, the health committee or whichever committee. He's been here before and he knows about, where we can support, where not. So I don't know why he's not taking advantage of us.
I think that's why he's here today. Now let's make
Can I also come on my own motion? Suomoto.
Yeah. You can invite us as a committee. What's wrong in having an engagement?
Yeah, because
Nairobi carries 7 million people. It's a very significant population of this country. Almost actually 10% of the population of the nation. So the health of this city is extremely important. So can we have a response to question number 5?
Chair, on question number 5, no, there was number 4, on why CHPs have been required to conduct SHA registrations for the public without adequate facilitation. That's an issue they have raised. It's an issue I've also raised similarly at COG. I feel that, you see, the 2.5 that comes from national shouldn't just be an assumption that then they take on any other additional task. Because, Chair, taking care of 100 households for one person is actually a task. And this network of CHPs is so critical because they know this house has this issue of diabetes, this other house has this. So there should have been some facilitation.
But Governor, I agree there should be some facilitation. But how about if we ask the CHPs, just in the 100 households they are taken care of, ensure the 100 households are registered in SHA.
That's what
So that as they go about their work, in terms of checking on these other things, they also make those inquiries. But I don't, of course, we are not saying they don't deserve additional thing, but I mean, it also enhances the health care, provision.
Chair, this, things improve with time, When I came to this house, we had 15 billion. We left it at now 18. My Senate has pushed it to 20. Chair, CHPs were getting nothing. I brought a motion. We started as Nairobi. Now they're getting something, 3.5. Ideally, CHPs should be at minimum wage, if you ask me. Because they're no longer volunteers. They're actually workers. They actually do meaningful work. If it was up to me, we would have a conditional allocation to all counties for CHPs to be at a minimum wage, because of the work they do. Then you can give them different tasks. The same way, my staff here, yes, they have their JD, but I can give them different tasks alongside health because they have a full salary, So that would be our proposal, Chair, moving forward, that CHPs actually moved to minimum wage. The next question is efforts to enhance training for CHPs on use of electronic community health information systems to ensure efficient reporting and awarding of marks. Chair, we have the CHPs report to CHAS, Community Health Assistance. We have employed additional, we've promoted actually some of the CHPs who've shown leadership. They've shown ability to manage teams and to train others. So those ones have been promoted to actually be employed as community health assistants. These ones are now as county employees. They're trained on the system, and so they serve as the supervisors. They're providing mentorship, coaching, training on niches to CHPs on a day-to-day basis. Chair, in one of the mental health, trainings that we had with these CHPs, and I tell you, I really love these CHPs. One of them said that their stress goes down because I'm in their WhatsApp group, and when they raise issues, I can see. Such things actually help us because mental health is big for them to be, at a good mental space, and that is what Dr. Gunu, you told me that. I'm sure, I hope it is true. Yeah, but I'm on the WhatsApp group with them, and that's what they said, And so I think that brings us to the end, of that question.
Thank you very much. Now we have two statements that are related. The statement by Senator Hamida Kibwana and Senator by Thabeda. All are dealing with Mama Lucy. And they are not, because Governor, we want to try and dispense with this so that new statements can find their way into the House. Can we have responses? And I think they can be handled together. They are more of similar questions. We can have just a comprehensive response of the two questions by Senator Hamida. The question by Senator Mutinda is on state the total number of women detained in the hospital facility due to inability to settle maternity fees, stating the respective amounts owed, state the payment modalities or options in place set by the hospital management for defaulters, explain the protocols followed by the hospital management in the event a patient is unable to raise maternity fees. The one for Senator Mida is asking for a report on the extent of overcrowding and strain at the Mama Lucy Kibaki, outline measures taken by the county government of Nairobi to address overcrowding, and then clarify the steps being taken by patients are not unfairly charged for services they are unable to access due to current constraint, recommend measures on how the national government and the Ministry of Health can support the county government of Nairobi to improve. I think those, since you have written responses, you can give us just a whole summary overview and just allow senators to ask if there's a specific question they want to deal with.
Thank you, Chair. And Chair, I agree. Now that we'll exhaust all of this, and I want to commend your clerk, Humphrey. He has found a way to be able to communicate better with our county, such that we don't have the backlog that we had before. And so whatever comes to this committee, Mr. Ringera, who was my campus mate, will be able to make sure we dispense with very quickly, Chair. Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we are refining. Because you find people ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register onto SHA. Register onto SHA so that you can be covered. But you see, also keeping them for long is a cost because you have to feed them. They're taking space others would have taken. But imagine if everybody who says they can't pay is released immediately. All facilities will collapse. Chair. If people had the option of not paying, they will not pay. Even those who can pay. So, Chair, we have a waiver guideline, we have a process of waivers, partial waiver or full waiver, that hospital by hospital we do. Chair, when I go to those hospitals, and the CEOs will tell you, even those who could, all the women, they come running and they say, oh, Governor, tumekwama hapa. Sometimes it is not true. They say there's been there for 3 months, it is not true. I don't waive for them, I pay. The only difference is, Chair, I don't put it on media. And I think people should stop carrying cameras to hospitals. You're going to see someone in a hospital bed, you're there with your camera, you're looking at their leg. It is very indecent. It takes away the decency, of that patient and the dignity of that patient. You must respect their dignity. So, Chair, that's the waiver system we have. We will keep on doing campaigns for health insurance because health financing is a critical aspect that this country needs. And I'll tell you an example. Today, in my level 2s and 3s, my primary healthcare facilities, I think I'll invite you to come to Embakasi South or Embakasi East. You can go to Tasia. Or we can go to Kwandeg, what do you call this? Kware dispensary. Kware is now level 2. All my hospitals have assigned, you walk in and walk out. If you're not registered, we register you there and then. Because PHC fund, imagine that hospital that was just like 2 containers is getting 1.7 million shillings a month at the minimum. The PHC is working perfectly. The problem we have is on the level 4s and 5s because of the SHA reimbursement that is taking a bit of time. But for the lower levels, and many people are also not being told, and I'll ask the SHA team, I think I saw the senator here, the CS here, and the CEO, to explain to people that you don't go directly first to the level 4 or level 5. Because those who go there are the ones who say SHA is not working. Because it is based on a referral system. You start at the lower level, and then you're then guided on where to go to. Those who do that have a seamless experience. I know people who've been paid for 300,000, 400, 180. In fact, the number of harambes that we are being put into for health have actually gone down drastically. So, Chair, on the issue of bed capacity, again, a city of 7 million people, the bed capacity required is tremendous. But I keep telling my CEOs, they have become victims of their success. People are coming to our hospitals because they know that is where they're getting good care. And that is why they're flocking in there. So we're continuing with infrastructure improvement, building more wards, hiring more doctors and nurses, because you must give that care. But the policy is you cannot turn away a patient. If a patient comes, you cannot tell them, no, the beds are full. Please, and that person is maybe even critical, or they're about to give birth. Do you turn them away? You don't. But the turnaround time is high. And that is why, for us to prevent that, those who have been cleared with are discharged as soon as is possible. We have those infrastructure projects. I have shown you Mutuini, which is going to have a huge bed capacity. Is it 300 or what? What is it? Mutuini? Mutuini, which is Mama Rachel Ruto. Mutuini will have 400 bed capacity. Mama Margaret is also big, 425. Mama Lucy, this facility that my senator was talking about, is adding an additional 120. And also there's another 300. So we're expanding. What I would ask for the support that Nairobi County needs. Chair, in the same way, we saw that in education, Nairobi needed affirmative action. That a county like Nairobi from 1992 had no new school built. with 7 million people, had only 210 primary schools. You can compare with your county. You know how many primary schools you had, because my guest of honor on that day was a former MP from Eldoret, was in Gishu, Eldoret North, former Eldoret North MP, who is the president currently. And he said when he was an MP, he had one
mental health wings. We've gone to many hospitals, and I think, of course, Nairobi being one of them, that you find mothers who have they have lost their babies in the same wing with the ones who are breastfeeding. It's really, it's, they fall through, they go through depression. So mental health issues. And I said, I'd requested, the postpartum depression who are going through that, can we have a separate wing for them in every, county for them? And then number 2, yes, inspection. Then one last thing, when a governor, let's take advantage. I think we've been having even many investors who have been interested to build hospitals. I don't know whether they've approached you. So in case we have, and maybe we have been having many proposals on that, why don't you take advantage? At least the legacy for you in Nairobi, it's healthcare. Health is wealth.
Yes,
so let's take advantage of
that. Governor, 1 minute response.
Thank you. Chair, I agree with Senator Hamida and also Senator Onyonka. Number 1, we have to be creative. There are many partnerships that we've sought now. We're working with the Swedes or Novo Nordisk guys for the Danish, sorry to their country, on the issue of diabetes. And you'll have a center of excellence. The first research hospital public research hospital is going to be Bagathi, working in partnership with Kemri. So that even these who are doing great medical research can do their clinicals within our hospitals. Chair, if you look at Mama Lucy, now it has an annex in Umoja that is the first public eye hospital where we're even doing admissions, we're doing surgeries. That had never been done. We're manufacturing the spectacles from there in Umoja too. And I would wish you come see it. There was an old man, and I always give this story, 91-year-old, he had not seen for 50 years. He went to Umoja 2 when we were launching. We gave them 1 month of all free services. He regained his sight. And he started saying, I'm not going to leave this hospital. Because he felt if he leaves that fence, the sight will go back. That he's only seeing because he's in there. And you could see him asking his son, Kumbe, you look like this. I thought you're more handsome and what, and joking. And there are many such stories. Regaining sight, now you're finding people from all over the country are coming to Umoja 2. They know the matatu to take to reach Umoja 2 because of that eye hospital. I've talked about dental services that we've increased across the county and dental chairs that were never there. Many of us never went to a dentist growing up. We thought that's for rich people, God has helped us that we can still smile, But there's such transformation when you change governance. On PPPs, we're working on one currently in Isili. Isili, we have beautiful land, big space, abandoned facilities. Investors have come and said, look, we want to partner with you. We put up a hospital, public hospital to the level that you want, and allow us also to have our own private wing. It makes sense, We need to do the same for expansion even of the Nairobi Funeral Home. Because the same quality today you're going to get at these private facilities, whether it is Montezuma or whatnot, let me not mention the brands. Today, if you go to Nairobi Funeral Home, remember the smell that was always at that roundabout. Always. It has improved tremendously. It's called Nairobi Funeral Home. What formerly known
is the generator working?
Formerly, there are many generators. They are working. There's even now a chapel.
Now let's make progress, Governor, because we have one more statement
on the final one.
That's finalized. That's what we.
FIF. FIF is extremely important. One aspect that I raised, because I called all the facility heads to chat out City Hall, and what one of them mentioned made so much sense that now they have to do accounting work that they were never trained to do, because they have to account for all this money, and we have now been taking them to courses, training them on these financial management skills. There is a no cash policy, so we've sealed the leakage. The FIF has gone up. There's no cash policy. All of it is paid through the system and retained at the facility. That's why I could give you the example of Embakasi South. At small level 2 getting 2 million shillings a month. Now the story of shortage of drugs is a long forgotten story because You have no excuse. And the Wananchi's interaction with the hospital to know whether it's working or not is not whether there's a doctor. They never know whether they see a doctor. Actually, most Wananchi don't see a doctor, they see a clinical officer. They see, if they see someone in a lab coat, that's a doctor, you know. But of course, we have doctors in our facilities. The test, the pudding in healthcare is kama kuna dawa or if there's no medicine. And once that is sorted out, we are seeing the public now, more of them come into our facilities, Chair. Chair, I can leave it at that.
Excellent.
Yes, Senator Onyonga.
Governor Sakaja, if you to listen to what you said, and I remember
we don't need the permission of Sakaja to go to any facility.
no, what I'm saying, Chair, is that in case he's going to have the by-elections, you know what I'm saying, he might think we are going to look for votes. So we just want to visit.
The facilities are spread across Nairobi.
60 other sub-counties
Exactly.
that don't have a by-election.
Yes. Now, members, because we have only one statement from Senator Okiomtata, I've gone through the statement, and I think we can still dispense with this statement before it is 2:30. I think we shall have cleared our books with the county government of Nairobi. So I'd ask Governor, a statement was sought by Senator Okiomtata, the senator from Busia, and I have seen the team from Bagadiwa here. I think this can be adequately addressed. I've also gone through the responses. There was an allegation of abuse of medical bill waiver facility at Bagadi County Referral Hospital, including involvement of hospital staff management in the said malpractice. Then number 2, the veracity of allegations of threats, intimidation against staff and patients and their families, and indicate measures in place to guarantee safety and protection. Then number 3 is audit of collection of parking fees at the said hospital, determining whether due process was followed in the introduction of the charges and clarify how funds collected are utilized. The mechanisms the Ministry of Health has put in place to monitor and ensure proper administration of medical bill waiver facility in public hospitals across the country. But I think if you reframe that within Nairobi County, you tell us what you are doing about it. And then number 5, whether there are regular audits of public hospitals specifying whether Bagati County, I think the rest of the audit we shall deal with the ministry. But we also want to know from the departmental level of your county government, do you do regular audits to your facilities? So I think if we can get those responses, I can see the CEO is already positioned himself, Governor.
Yes, Chair, I'll just give a general overview and the CEO can quickly run through it. Chair, our intention, as I've said, is to enhance autonomy of the hospitals, especially the level 5 going up because of the potential that they have. Chair, a hospital ideally should run itself. If you go to any private hospital, even if the charges are a bit higher, they run itself. Lab is profitable, you know, the issue of medicine, etc. And that is where we're moving to without overcharging the patients. And Mbagathi is one example of a center of excellence in the country. In fact, the CEO has been receiving delegations from other parts of the country to see how certain things are being done, and he can be able to explain that. I think the last team was from, was it Nakuru, on the issue of neonatal ICU. So, Chair, the waiver process has been outlined, and we've given the sample waiver forms and the process that is undertaken to provide the waivers. The issue of intimidation and, you know, we needed more information there. The answer is that the allegations are not true, but the hospital has an anonymous incident reporting system, and we encourage, and that guarantees safety and protection of whistleblowers, including, you know, if something must be escalated at City Hall, there is actually provision to write directly to me, and I'm the only one who opens those letters. No one else opens those boxes. I'm the one who personally goes around to open. The audit of collection of parking fees, whether due process was followed, introduction of charges. Chair, we have 2 hospitals where we had to introduce parking fees because people would come, leave their cars, and then go to town. And so patients or people who need the services don't get. You know, so Mama Lucy Hospital, which now the parking was full throughout, of people who are not seeking services, including even sometimes matatus, previously, as well as Mbagathi Hospital, has had to be introduced. But was about
before you leave there, so that because we are short of time. Now, those parking fees you are collecting in Mama Lucy, and Mbagathi, I hope the revenue is going to the hospital.
FIF direct.
FIF.
No, not to the county.
Yes.
That is FIF. They did a revenue share model with the person who installed the equipment.
That's okay. As
So
long as whatever is due is remaining in the
there.
facility.
And soon I told these CEOs of mine, I will stop paying their doctors and nurses. They must take over that payroll. So we are seeing the growth of these hospitals. These hospitals can actually stand on their own. Once SHA is fully, the reimbursement is guaranteed on time, we can be able to move all of this stuff to the payroll of the hospitals, so that we can have, them as almost level 6, but not in terms of speciality, but in terms of autonomy. So CEO, whatever I might have left out, kindly.
Chair.
Why don't we allow the CEO to finish what we can just ask them?
Okay.
Thank you, Excellency. I think, Chair, Honorable Senators, I have nothing to add. His Excellency has addressed everything.
Chair.
On a CEO, that's a joke of the year. Now, there are only two specific areas the governor has touched on. I expected you to tell us something about the issue of audits, whether your facility has been audited. Do you have any report? I also expected you to tell us that now that this revenue is coming, how are you utilizing?
Thank you, Honorable Chair.
And on the issue of, I don't want us to wish it away, Governor. On this issue of allegation of malpractice, I think you must speak to it, Pana CEO. It cannot just be. Senator Okia Mtata is not an ordinary man. And he's a lawyer who is not trained. And he does extensive research. By the time you see a statement, just know there is information. So I think clarify whether there have been such incidences before they have been dealt with, and what is the position. I think that one line sentence is not sufficient.
Honorable Chair, well guided. On alleged abuse of the medical facility, the response is false. It's not true. There are controls to ensure accountability in the process. And to achieve this, Honorable Chair, is that the medical facility is managed by a standing hospital committee, which comprises 1 medical social work in charge, the ward in charges, these are the nurse managers, the overall nursing services manager, the hospital administrative officer, and the hospital accountant. Honorable Chair, Honorable Senators, the beneficiaries of this facility are identified among both outpatients and inpatients, and mainly include patients not registered with SHA, street families, gender-based violence victims, patients without social support, mostly from slums, and the wrong state discharged patients. Honorable Chair, Honorable Senators, the nature of these waivers are in 2 categories, namely full waivers and partial waivers. Roman 1, full waivers. These are patients who cannot raise any amount to offset hospital bills. Roman 2, patient waivers, partial waivers. These are patients' bills partly paid by SHA but cannot raise a balance, or the patient or the guardian able to raise a percentage of the hospital bill. In this case, a favorable amount is paid directly to the hospital account, and an official receipt is raised, and the remainder of the bill is waived. In both instances above, Honorable Chair, the committee determines the applicable criteria through a vetting process in partnership with relevant community health promoters, area administrators, mainly chiefs, religious leaders, and political leaders, mostly area MPs and MCAs. Once the waiver committee makes a determination on either of the above, an official waiver form is issued to the beneficiary bearing patient's information, signatures which imply approvals of the committee membership, and a record of the beneficiaries is filed and kept by the Hospital Medical Social Work Department. After the management executes this process, it is subjected to the Hospital Board of Management on quarterly basis for audit of the process and ratification. Question 2. The veracity of allegations of threat and intimidation against the staff. Response. The allegations are false. The hospital has an anonymous incident reporting system that guarantees the safety and protection of whistleblowers, and this is addressed by a committee who opens the boxes and analyzes issues raised. Question 3, Honorable Chair, Honorable Senators, an audit of collection.
The department, let us not go far. Waziri, how many times does your department audit your facilities? When was Mbagathi last audited?
We audited Mbagathi last year, that is the year 2024, 2025. The audit is currently going on. We submitted the 2023, 2024 to the County Assembly as well. So it's audited annually.
Thank you very much. Senator Onyonka.
Chair, thank you. I just have two small issues. The MD of Mbagathi Hospital, I don't know whether it's, yes. I wanted to say that thank you. Chair, I've had cases of my people from Kisii who have been having challenges with the treatment of certain diseases, and it's been extremely very welcoming. And I've also seen your facility, two recommendations, and Governor is here. Governor, I've noticed that many of the projects we do, either as a country or as a people, we never keep any maintenance money or maintenance teams to clean up the facilities and keep on repairing them as we use them. I don't know what you are going to do about that. And the final one, I sit in the Finance Committee, and one of the recommendations that was given is that we need to have internal auditors in all these facilities that you're running, who will be having frequent audits in order to try and manage and control the use and the management of your facilities. Otherwise, Chair, thank you so much.
Before you respond, Manasiyo, I've looked at the revenue sharing agreement for parking. We are only getting 30%. Why? And for how long? When is the revenue sharing going to be 50-50? 30% is on the lower side.
Thank you, Honorable Chair.
Let's Senator Kamau, so that you can respond to all of them. Senator Kamau.
Yes, thank you very much, Chair. I wanted to ask the Governor, now that we are in the process of encouraging people to register for SHA, I just wanted to know what is the number of registration of Nairobi County, the people that have registered on SHA.
You can respond.
Thank you, Chair. As I get that number, the CEO has mentioned, and the question that has been asked about the quality of the service. I'm glad the Senator Onyonka's people go to Mbagathi. I want to tell you, Chair, I myself have been treated there, and my father goes for physiotherapy there. It is at the same level as any other hospital you'd go to in this capital of Nairobi, whether it is the private ones which have been known for a long time. The level of quality I got there. In fact, the doctor who saw me, what was his name?
Dr. Masini.
He is one of the best, you know. His specialty is in orthopedics. He's in orthopedics. I had an issue where I fell from a motorbike. But, and don't ask me the context. But, because I ride bikes. He treated me so well that I've kept going. My dad does his physiotherapy there regularly. He leaves Kitale, comes to Nairobi, straight to Mbagathi. And he says he doesn't want to go to the other hospitals I used to take him to. And we need to encourage that, use of our public facilities, especially by public officers. Because the same quality I expect my person from, Kibra, which is next to Mbagathi, of medical care to get the same quality that I should be able to get for myself and for my children. Now, the problem with the children, they're not ours alone, they have mothers, and their mothers have their preference. But it was up to me, even my kids would go where I go to, because I'm a patient at Mbagathi, niliandikiwa card, I have it over there, and at least I have my personal doctor. Chair, the issue of maintenance is important, which is why, and now we're moving to the level 4s. The introduction of CEOs in level 5. A CEO looks at the 360 degree of a hospital. From how does the gate look like? How is the signboard? How does a watchman speak to Mwananchi when he comes in there? Are they welcoming? Is there a reception? Is there signage that shows you directional mapping? Doctors are good, but they focus more on medical and clinical and technical issues. So that has helped us do some, well maintenance. If you come to those hospitals, you will see the gardens are taken care of. The quality of paint, the aesthetic, even the aesthetic value, the food. They look at what the patients are getting, etc. And we've seen huge improvement. And now at the level 4s, we are soon advertising for also those facility heads of that nature that can look widely, because our level 4s have realized in Nairobi almost like a level 5 elsewhere. Because of the sheer number of people that they see. So that is what we intend to do.
Thank you, Your Excellency. Honorable Chair, the sharing formula was determined after several considerations. We sat down with the FEDA and we also worked on his return on investment, and we have transferred some risk to him, like other than the installation of the machine, is doing the maintenance of the equipment, including updating of relevant software and other physical infrastructure, ensuring the parking area is clean, and such other things. So it will subsist for a period of 3 years, then we'll do a review. Honorable Chair, thank you.
Thank you very much. At least the period is fairly good. So, Senator Kamau, there is only one more question that asked about how many people are registered in SHA in Nairobi County.
Yes. On SHA, we have 2.9 million people now registered in Nairobi. That is 42%. And so we keep telling them, *147#, register, join SHA. Even the short code has the county number of Nairobi, 47. So we are the biggest champion because it's really helped our facilities, especially at the primary level. Chair, just as a by the way, or maybe as a diversion, when we are here, people are watching us, and somebody has sent me a message asking for money to go for radiotherapy at a private hospital. I want to tell him it's called Tobias, go to Mbagathi, and you will receive that service the same way we're being treated there. I've just seen that message on my SMS, Chair. Chair, we humbly submit.
Thank you very much. Maybe, honorable members, if there is anything else other than what was on the statements. So thank you very much, Governor. The last time we made a visit to Mbagathi and the Nairobi funeral home, and the funeral home was not in a good state. All the generators were not working, all the fridges were not working, so I hope there is improvement.
Chair, in fact, one of the issues we had asked was, Governor, I hope you've solarized all your health facilities.
Not all of them. Solar is expensive, so we're looking for partners. The initial cost of setting it up is a bit high. So we've been able to do some markets. We are looking at the facilities if we can do through FIF, because we don't want to pump in more money in hospitals while they're actually receiving money. The markets don't receive money, that is comparable.
So I was just saying, Governor, when we visited the Nairobi funeral home, there was a huge problem. So maybe just in a nutshell, tell us the improvements we have done. We noted that the generator was not working, the fridges were not working. We had also issues of staffing in that place. And I'm happy now that KMTC is now training mortician. One of the problems that we had was it has to be training on the job. But now KMTC is training personnel, so I don't know whether you have improved the number of personnel. The few are there were complaining about the workload. And the other thing that was a problem in Nairobi Funeral Home are unclaimed bodies, and also bodies that are brought by the police. And I actually made a recommendation that there is need to have a separate problem mortuary because of the nature of Nairobi and the issues of crime and all these unclaimed bodies. It is completely necessary to have a separate mortuary to handle issues of police, because the bodies are kept there for years and before the matters are concluded, and if they are mixed with the regular bodies where families come to take, those staff there specifically made that request that their work would be made easier if they are dealing, with the issue of normal bodies from facility and so forth. But the ones that have police issues should actually be kept in a separate place. So maybe you can just make that. But otherwise, I want to say thank you very much for. Yes, Senator Amina.
Just a second, just one question. I was just wondering on mental health. Do the morticians and maybe all the people that handle these bodies, are they taken through mental health? I mean, are they taken through counseling and all that? And one last thing, I mean, it is really important. But one last thing is that one last thing is about medical equipment. I hope all equipments, working at this time. The medical equipment is quite thorny. It, Gaba. Thanks.
And I encourage all of us who are here for purpose of mental fitness. It's good to once in a year you visit a mortuary. It works up. It will help you wake up to the reality that do something when you are still alive, because
Chair, when you see my
the city mortuary from one end to the other end, and she was at first timid but became very friendly. And I got used to it. I've gone there more than any other leader in this city before, and I keep going. If I pass by Baghdad, I always pass by the funeral home. I know those young ladies who we met. At that time, there were 14 of them. We've onboarded them. They have come and buy also some casuals. Senator Hamida, morticians love their job, and they really enjoy their clients. Their clients are not rude. The clients don't complain. They don't talk back. If you ask doctors, the chairman of the Nairobi Funeral Home is Dr. Johansen Odo, who is one of the highly acclaimed morticians in our country. And if he tells you stories of what is dealt with, it's a calling, when I was in Chiromo in campus, the medical school students would also start in Chiromo and our school of math. In the funeral home, it is something that you're good with. But I hear you, actually for all our staff, wellness is available for them. It is in the